everyone.
I think it's gonna happen.
It is still morning.
New York, just like
We're gonna have to do some fancy footwork to get through this one.
Northwest Chester County.
We are going to start the Health, Human, and Social Services Committee. The first order of business is to approve last month's committee meeting minutes. Motion made by Supervisor Frazier, second by Supervisor Strau. All in favor?
Aye.
Opposed? Carried. Hey, as they say in Saratoga, Chris, giddy up.
I'll go as quick as I can. The first item I have for your consideration is a resolution request for a new contract with BOCES. This is for our Operation Food Chain that we do every summer. This is where they hire a crew chief, we hire the kids, the crew chief oversees the kids.
Okay, motion made by Supervisor McDevitt, seconded by Supervisor Sieber. All in favor?
Aye.
Opposed? Carried.
You go faster than me. The next one is a correction on our budget. Our program funds, there was a new act of Congress last year. We were under the impression that we needed to use a new account code. So when you approved our budget last June, we created a new code 41. When we went to roll over our budget, which runs from July 1 to June 30, at the end of the year, the treasurer advised us that we didn't need to use 41. We can continue to use code 40. Makes life easier for the treasurer.
Okay, motion made by Supervisor Braber, second by Supervisor Sieber. All in favor?
Aye.
Opposed? Carried. I said giddy up, didn't I?
And then finally, we moved into our new office on Friday and Monday. Kudos to the buildings and grounds that moved us. They did a great job. IT is still there, getting our phones up and running. There were some snafus, but the last item is for request to host a meeting or conference for our June Workforce Development Board meeting. We'd like to have it on the 9th floor of the new office space.
Nice. Okay. Motion made by Supervisor Simpson, second by Supervisor Frazier. Any discussion? All in favor?
Aye.
Opposed? Carried. Okay.
I'll make sure to send out invitations to everyone if you
Nice.
or anytime you want to stop by the new office too. There's still some bugs to work out, but it's nice space.
Finally.
Yeah, finally.
Oh, yeah?
Not yet. Well, maybe they have it fixed by now.
Oh, okay.
They were working on it when we left.
Yeah.
So, yeah, if you get voicemail, you know. Yeah.
I'm gonna read. Okay. Anything else for Chris or Sharon? Or
Thank you very much.
we're all good? Yes. All right. Briefly, I've got Christy Sabo could not make it here today. So for Office of the Aging, Amanda's going to hand out some resolutions that we need to take care of on her behalf. Okay, I'll start while she's passing them out. I did, in the interest of time, I did read over the email that she had sent over yesterday. The first request is to create and fill a grant-funded position of specialist, but I believe Trish Nenninger had changed that, had changed the wording of the actual position. Is that on here, Amanda? Okay. At any rate, this position is through a New York Connects coordinator program. This year, the program was expanded, and there was additional grant monies awarded. This is also called the BIP program. I don't know if you've heard Chrissy refer to it, but it's Balancing Incentive Program. As of last year, we had 337 individuals served under this, and as of last year, there were 650, so it basically doubled. But this position is 100% grant funded, and it's one of those deals where if the grant funding goes away, so does the position. So, okay, for the record, it's the Services Specialist Office for the Aging. Motion made by Supervisor Simpson, second by Supervisor Bramer. Any discussion? All in favor?
Aye.
Opposed? Carried. Okay. Next is, oh, my bad. She gave me too many pages to look at. Okay. We now need to amend, resolution, 60 of 2016. This one was, a correction to Schedule A. It was, the amendment was removal of the contract for home health care of Hamilton County and additional monies to Greater Adirondack Home Aids. It was basically a $3,000 correction, I believe. Do you guys have these schedules here? Okay, I think the original one was somewhere in the neighborhood of 52,000. Oh, actually, it's right in here. So yeah, it looks like about a $1,500 correction. So we just need to get a resolution to change this correction, or make this correction. Motion made by Supervisor Sieber, seconded by Supervisor Stroh. Any discussion? All in favor?
Aye.
Opposed? Carried. Okay, on to 3. This one, it's a request to appoint advisory council member, Kathy Hutchins. At the time of the resolution, she wasn't quite sure if she wanted to do this. Now she has reconsidered and wants to do this. She is very qualified, and Christie has all the confidence in her. So we need to add her to the committee. Motion made by Supervisor McDevitt, seconded by Supervisor Simpson. All in favor?
Aye.
Opposed? Carried. And lastly, this is a meeting for Christie. She attends this once a year. It is open for anyone to go to from her office. However, she is doing the overnight. It's a 2-dayer, and it's a total cost of $180. It is in her budget, so she does have the funds for that. Okay, motion made by Supervisor Simpson, seconded by Supervisor Stroh. Any discussion? All in favor?
Aye.
Opposed? Carried. How do you think so far, Chairman?
You're doing good.
All right. She did not have any pending items. Anything else for the Office of Aging? Okay, otherwise let's get social services on.
Noontime when they opened at Jackson Heights.
Yeah.
Craig, highlighter?
You got an extra agenda?
Nobody.
After a crazy day yesterday for me.
Yeah, she has the attachments.
Little
The
home
friends are
life
so online, the Republicans, and they
crisis.
You can drag your heels, we're feeding you.
Here's the burn.
Wow.
It, you know, just generally, as well, party affiliation, whether they're Republican, whether they're independent. Hearing that, congratulations.
Yeah, and then the public knows what we're talking about without.
Okay, Maureen, take it over when you are ready.
Okay. Good morning. We have a resolution request for permission for the heat supervisor to attend the 2016 NYSERDA Low Income Forum on Energy in Albany. And, we feel this is essential for somebody in heat to attend this, and the cost is $185 for the 2-day thing, and she will be driving back and forth.
Okay. Need a motion to get this on the floor, made by Supervisor McDevitt, seconded by Supervisor McDonald. Any discussion? All in favor?
Aye.
Opposed? Carried.
All right, our second resolution request is to extend the temporary appointment of Tammy Breen to Case A supervisor for an additional 3-month period. And we feel that we can complete some of the compliancy projects and assignments relative to the Case A supervisory work And if you want more information, Cynthia will be glad to share it with everybody.
Yeah, this is one yeah, go ahead. Motion made by Supervisor Simpson, seconded by Supervisor Bramlett.
Can I just ask a question?
No,
Okay.
everybody's hungry. No, go ahead.
Is all the 426 and everything been processed, so she's receiving her additional pay now?
Yes.
Is it met everybody's approval? Because I saw another email yesterday say where it didn't. Does it or didn't?
It did, she will be paid, this pay period is
Okay.
already in.
Okay.
I think we got that settled down.
Okay, just making sure.
And we will, if this is approved, we'll put the other one in and make sure it comes quickly.
Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Carried.
And then for our information for discussion or review, we just wanted to let everybody know, April is Child Abuse Prevention Month, and we had one activity that we did in front of our building, and if you drive by there, you'll see little pinwheels, and some of the supervisors came to see that, and one of the papers came too, and I think overall, a very good small thing to do, to show that we want to keep making sure we're preventing child abuse the best way we can.
Can I ask what the significance of blue is, the color blue? Is there a reason why? Go ahead, Rachel.
Oh, unless you want it,
Supervisor.
No,
did
go
you have
right
it?
ahead.
Oh, the color blue, particularly that dark blue, represents crime victims. And, Crime Victims' Rights Week was also last week. It's the same month, or it's just a week within the month of Child Abuse Prevention Month. And so blue signifies victims of crime.
Oh, okay.
Every event has a color that signifies to lapel pins and whatnot.
Thank you.
Thank you. Sure. And then we just have Julie in the budget.
Revenue and expenditure report, we're pretty much right on target where we should be, or want to be for March, the end of March. Revenue's coming in, as well, which usually the beginning of the year, it's usually a lot slower, so that's really positive. At this time, I don't see any problems, I don't project any problems with our budget this year. And for our overtime, we're working on trying to keep it down as much as possible. Even though we don't have any control over when we have staff on call, how many calls they have to go out on and that kind of thing. So, but for the year so far, again through March, it's looking really well.
Looks like we were right around 70-hour savings compared to last year so far. That's
Yep.
good. Very good. Okay. Is that it?
Yes.
Anything else for social services?
I have one question. The state budget impact on social services, no change? Yes, no?
Our Medicaid shares did go up a little bit.
You're getting a little more money. Or a little
No, we
No,
have to
no.
pay out a little more.
Paying out a little more.
Actually, it ended up being exactly $170,000. At this point, I am hoping we can absorb it. Till August or September is where we see where our costs are. It's really
Too
hard
early.
to project. I would not ask for more money this early in the year because there is that hope that we can absorb it. I was really disappointed because everything led us to believe that they were gonna go down.
Yeah.
I had a lot of emails, that kind of thing, during budgeting time, and, the consensus was that we would pretty much keep things even from our Medicaid share last year, even though the talk was that it was gonna go down, so it could have been a lot worse, because we did not budget down, but we budgeted even, and they did come in a little higher.
Thanks.
Thank you, ladies.
Thank you.
Thank you.
Okay, I think Pat is outside.
Gosh, we're gonna make lunch break on time.
you, Pat?
Here's your bumper sticker, so
Salary,
it was
so I
ever
warrant
mine.
it for manual
Say
salary.
Bernie, you know, and
Anywhere you want.
So,
the first bumper sticker I'd
I
ever
guess
seen
getting
where
raises to people with coverage and
You're gonna keep it close.
giving people raises, just
put Bernie one.
temporary workers.
Good, good thinking.
That's what I'd like to know. It's not, I'll check the math on it later, but, you know what I mean? Like, she's doing the work, she's doing 59, that's
We're doing good.
salary. Instead of, getting rid of all now, we just do, I thought we were getting rid of stipends. Now we're doing more stipends.
It's okay, Pat, we are ready when you are.
Love it, with the Trump strain.
We have a late breaking agenda item that, I didn't have
So
full
entertaining.
information on until yesterday, and that is to request a resolution to authorize Robin Andre and Nancy Guest to attend the 23rd annual, professional lactation conference in Burlington on May 5th and 6th. That's a cost for the conference is $275, which would be $137.50 for each employee. We didn't put this on initially because we were waiting for them to tell us whether or not they were gonna give us tuition assistance, and we found out that they would. So that cuts the conference cost in half. So we'd like to, request permission for them to do that, and also to request that the GSA, will be waived to cover the lodging at the conference site, which you can see the difference in the rates. The nurses will share one room as opposed to each getting their own, so actually, less than it could have been. And the conference is necessary because they're both certified lactation consultants, and in order to keep their certifications, they need to be, they can do it all at one time.
Okay. Motion made by Supervisor Bramer, second by Supervisor Frazier. Any discussion on lactation? All in favor?
Aye.
Opposed? Carried.
Okay, moving on, we're very happy to announce that Valerie Wizon, who's one of our supervising public health nurses, who joined our agency in February of, 1992, has been promoted to the Assistant Director of Patient Services, and we will, bring her to committee and introduce her next month. But since she's still doing her old job, because we don't have anybody to do her job, she's still down there doing, so anyway, just so that's one position that's filled. The other thing is we would like to request, committee approval, and we've gone through all the hoops. I did talk with, Chairman Garrett, and I talked to Matt about backfilling that position. So, if we could get, approval to move that along, that would be helpful. And again, the salary for whoever fills that position would be less than the current one, mainly because they're not gonna have the amount of experience.
Okay. So you need a motion for this?
Yeah, just to move it along so it has good personnel, isn't that how that goes?
Is it a budgeted position and you're keeping it?
Budgeted position, yeah.
Then all you need is a notice of intent to fill sign.
Oh, okay, I
As
did.
long as you're not changing the amount of salary.
Well, it's gonna
It's gonna
have a
be
different
lower.
salary,
Okay, then it will go, I'm sorry, it will go to personnel.
So we do need
I
a,
was writing it up.
we do need a motion
Yeah,
then to
you
move this
signed
on to
it for me.
personnel. Motion made by Supervisor Simpson, second by Supervisor McDonald. All in favor? Opposed? Carried.
Okay, moving on, we'd, also like to request a resolution to accept some funding in the amount of $3,195.77 from an insurance company for repairs to a vehicle that was, hit while the nurse was in the driveway. The person came out and it was, they hit into the car. So they covered it in full, but we have to accept the funds and amend the budget.
Motion made by Supervisor Strauss, second by Supervisor McDonald. All in favor?
Aye.
Opposed? You're opposed? Question?
I do have a question, it's on the last one. The one that we
Okay.
just, didn't we amend something at the last full board meeting to cover this situation? Got it.
That was,
It's
yeah.
a difference,
Sorry.
Yep.
yeah, but similar, different.
Okay.
We would like to request a resolution to authorize Janelle Jones to enroll in a job-related course, Principles and Methods of Epidemiology, at the SUNY School of Public Health. State Health Department is looking for local health department people to have these conferences, and we would rather not have that, but, she is willing to do that. So if we could be able to reimburse her 50% of that cost.
Okay. Motion made by Supervisor McDevitt, seconded by Supervisor Bramer. All in favor? Opposed? Carried.
I'd like to, request a resolution to create a part-time not to exceed 20 hours with nutrition facilitator position. It's a, civil service grade 16 position, base salary $39,979, which would be prorated to an hourly rate of $19.22. The position is funded totally by the WIC program contract, and it's obviously contingent on continued, funding, and all of the information regarding why we need it was transmitted with your agenda information.
Okay. Motion made by Supervisor Strauss, second by Supervisor Simpson. All in favor?
Aye.
Opposed? Carried.
Moving on to pending items, in follow-up to our continued 2013 Fiesta vehicles. We're getting there. We have, one more, and I understand, I don't, maybe somebody else, we may have a couple more, so we're moving in the right direction. So unless, we continue to have problems, we'll obviously bring it to your attention, or if something goes wrong, I won't routinely put it on the agenda, and I hope I don't have to.
Mm-hmm.
But it's been a long time.
Yes.
Moving on to information for review, you will see a copy of the monthly emergency response, activity report that's, in your packet and also was transmitted to you. If anybody has any questions on that, we can move on. Moving on to the status of referrals. Tammy's gonna comment on that because we do have one issue this, month that is, we're going to be monitoring because we're not really sure why. But we're noticing that our PT referrals are down, and we're thinking maybe it's because people are going to rehab from the hospital and not going right home, and by the time they leave rehab, they're not needing us. So I don't know, Tam, do you wanna?
As Pat said, there were a couple of things that we noticed. When we first saw the numbers, of course, were not, I wouldn't say alarmed, because we've been looking at this and we'll see, you know, it's cyclical. Sometimes, some months will be down, some months will be up a little bit. We expected that we'd be down a little bit simply because there's competition now in our areas. There are other home care agencies. But what we saw on the nursing side, it was kind of a self-imposed decrease because there was a 4-hour assessment called the UASNY we used to have to do, but now as patients are transitioning to managed long-term care, the managed long-term care plans are now doing those assessments. We no longer do them. So we would anticipate that we're gonna see a decrease, and you'll see those in the numbers, and they're spelled out as the UASNY. So that kind of explains the nursing. The other piece was, as Pat said, the physical therapy. And as soon as, and actually these numbers, we saw these numbers before Sharon had left us, and she and I were working a little bit together on trying to figure out what was happening. We took no time in calling our partners and other agencies, and everybody's kind of seeing the same thing out of home care, which leads us to believe exactly what Pat said, that what's happening is because of a change in rehospitalizations and things like that for the hospital, that maybe patients are tending to go down more to rehab first, and then from rehab directly home without home care, where we were seeing a lot of hospital to home care. We're going to have to keep an eye on that. We even received a call, I believe, even from Hal Payne up north, asking if we were seeing that, because he was seeing that up there. So it's not something that others aren't seeing. We are going to keep an eye on it. And that's kind of, I can tell you our referrals right now, I think, are up a little bit. So we'll just keep an eye on it and certainly report and let you guys know where we're at next month.
This week, we're very, very busy. The other thing that did happen in the last month is we had a week that we didn't have any liaisons in the hospital, and normally we have 2, and a lot of our competitive people have liaisons down there too, so when we're not there to get our fair share, it shows. So if anything, it's good that it validates the fact that we're on the right track doing that.
What's this a source of revenue for the hospital?
Well, with the hospital, it could be, but a big part of the hospital, the issues that the hospital is having is that they will be penalized if a patient is rehospitalized. So sometimes what they'll do is send them, And they can change different plans, like a rehab plan. Maybe you wanna do more of a step down versus gone are the days where you stay there until you can go home without care. So then they were sending the home care, and there's no doubt about it, home care is it's the best return on investment, I guess, is the better. I hate to use the word cheap, because that's not, it's wonderful, good quality care, but certainly if you can care for a patient at home, they can, if they can't go to like an outpatient rehab, it's better than having them in an inpatient rehab bed. However, you know, there is, if you are in an inpatient, there are more, you know, more hours in the day that they can provide rehab. So I think with the Medicaid redesign team and all of the other thoughts behind Medicaid and Medicare and how best to care for patients, people are kind of trying to see what the best mix is. It, you know, 2 weeks in a rehab and then home care, or 2 weeks in a rehab to home, or so kind of feeling that. But the hospital will, if they're rehospitalized within a period of time, they have to basically provide care for that patient without payment. So it's very important to them that they, you know, that they make sure that once they're discharging their patients, that they're not coming back to them.
One of the things they have to do, and I think the liaisons are good, is they have to assure that at the time the patient is discharged, it's a safe discharge plan. And some of the situations, you can just tell without even, you know, that it's not a safe discharge plan. You're not gonna be able to send people home and have them have a good outcome. They'll fall again, and then that won't be good for anybody, particularly the patient. So, you know, again, it's a real effort for a lot of people.
Supervisor McDevitt, did you have a
Now,
question?
does the hospital provide at-home care, Glens Falls Hospital?
I don't believe the hospital itself does, but they do collaborate with Port Hudson. Now they have liaisons in the hospital from Port Hudson, and Port Hudson is a home care agency. HCR, I don't think has anybody there at the hospital, however, they are a home care agency in our area. The thing that we do, and I think we do very well, is we will go out and we'll take a referral on a weekend. A lot of agencies will not do that. But we go in and admit patients. We'll go to a patient's home Saturday and Sunday, and we'll admit them on a Saturday and Sunday versus, you know, 8 to 4 during the week. And I think we need to continue to do that, and I think we do that well. But I do not believe that they don't have their own, but they are collaborative partners in programs like the District Project, which we are a part of.
Some hospitals do though, like St. Peter's has
Right.
a home care,
Mhm.
with it, and some of the, like the Capital District, you know, people do. Some of the insurance companies also have liaisons in the hospital, which behooves us to have contracts, which is why we give the county attorney's office so much business getting the contracts up. Because if we have a contract with the agencies where the insurance company happens to have a liaison in the hospital, that's good for us. We can get through.
Just one last question. Does our nursing home, Warren, do they compete with you guys in
They don't
physical
provide
therapy?
Yeah, they don't.
They don't, okay.
Are our rates competitive?
Yeah, well, with a lot of the patients, you have to be careful when you set your rates. The Medicaid and Medicare, with the Medicaid and Medicare, they're both paid on an episodic payment schedule. So for a 60-day period, and that's a 60-day episode, you're paid based upon the diagnosis of the patient. So it's based upon diagnosis and things like your therapy need. And then Medicare and Medicaid, they're going to determine what they pay you. We still have to produce a cost report every year, and that kind of is the basis for what they determine they're going to pay you for that 60-day period. And it's based upon diagnosis and your region. So where we are, they'll set a payment, and they'll say, for example, we're going to give you $3,000 to care for this patient for 60 days, meet all their needs for those 60-day period. Then, as an agency, you determine, are we going to go out and we're going to provide 10 skilled nursing visits and 2 physical therapy visits. It's up to the agency themselves to follow their own protocols for determining, and it's all patient specific. Does the patient need more medication interaction, to make sure they're compliant with their medication? Do they need more help doing that? Is it a new diagnosis? The patient's new to diabetes, so they need to have more nursing time to just get them used to the fact that this is a new diagnosis for them. Or is it a hip replacement and a knee replacement where there's more physical therapy, less nursing? Nursing may be in there for medication reconciliation, but then really it's a physical therapist. So It's really patient dependent. Those are Medicare and Medicaid, and they're our primary payers still. Our Medicare numbers are down, but our managed Medicares are up. Most of our managed Medicares are on an episodic payment as well. So again, we're gonna pay you this much for a 60-day period, for the most part. We do have private insurance companies, and we contract with them periodically. Once we do our cost report, we'll reach out to them and say, you know, our costs are rising or holding steady, and we'll negotiate perhaps a better rate so that our revenues. So, to answer your question, you wanna stay competitive, but you need to, you can't lose money either. So, it's kind of finding that happy medium.
See, we need to have people that know about the business as well as the finances.
Yeah,
We need to know what we do, why we do it, and then try to be able to plug everything in so that it makes sense. Just by way of, personnel, just to let you know where we are, since it seems like we've been up here a lot lately, asking for all kinds of personnel stuff. Not my favorite thing to do, because whenever personnel changes, it obviously impacts the agency. We are backfilling the assistant director, so, and we are putting somebody in the temporary supervising position, which, is gonna cover for the person that we have out on long-term medical leave. So we still are, recruiting and interviewing for the other supervising nurse. We also have been, advertising for 2, staff positions that have been, created from, retirements. And I won't say we've had no luck, but we have yet to hire somebody. This week we've had a couple of, what I would say promising, resumes, so that we'll be working on that. And I'm anxious to get that going, and hopefully by next month, because we're gonna be into vacation season, and we do have per diems that will work, but when you're down 2 full-time people. And we did put one of our staff people is down, going to be taking the liaison position, so we're short. So if you know anybody that would like to work, please send them our way. And we do have now continuous recruitment, but we have to be careful, because we can't just, have anybody. I mean, everybody could get a new graduate, but new graduates are wonderful, but you've gotta have the ability to, supervise them. And in our business, if you happen to be over in Stony Creek, you're by yourself. So you have to be able to, you know, have some experience to draw on. And we are hiring people and mentoring them with less experience than we used to, but we've still gotta be smart about it, because it's not fair to the nurse, and it's not fair to the student. So we'll keep you posted on that. Hopefully we're gonna have more good news to report to you next month. So Todd, moving on to expenditures and.
Attachment number 2 is our, current fiscal status. We are in the middle of coming to the end of this week, beginning of next week, closing the month of March. So revenues are down because that's not reflecting into March yet. Expenses are pretty much up to date. Also to know, all of 2015 has been submitted to the treasurer's office. We finally got our preschool, billing that was up until the end of the year, and also our WIC food voucher numbers that we did and gave all those, so that should be posted. They're most likely not reflected because I did this last week. But hopefully by the next month we will have what 2015 finally was. Regarding payroll, again, it's the same scenario. As Pat said, we're down some positions, so therefore you see a reduction in our regular salaries compared to last year at this time. Our overtime is down, which is good because we're utilizing per diems for that, and that is why our part-time salaries are up a little bit. That's where our per diem line is. You'll see that at this point, we are 23.93% of budget regarding salaries, and last year at this time, we were 26.36% of salaries. So, on that end of it, we're doing very well. Attachment number 3 is comparing, this year to last year at this time, as of April 14th. And, you'll see, we're pretty much down compared to last year and everything. And, one big thing that's hit us that we've seen this year is our long-term care program is no longer. I think we have 1 patient left in it, and the state has shut that down, and hopefully we'll get them back into our CHOP, but they get to choose where they wanna go. So, those revenues and, expenses are no longer really being reflected anymore. So that's why you see compared to last year, that big difference. Otherwise, we're on track.
Have any questions? If not, that's.
On that drop in revenue, is that
we haven't closed our month of March yet, so that's one of our big things, that right there will be the case. And long-term care is where we usually got revenue from in the past, and we have, like I said, we have one patient now compared to last year. So that is expected on the long-term care.
Supervisor Bramer.
Thanks. Are the positions posted on the county website? That how people are getting?
In our website as well, and we actually have posted them. We can't, we've posted in CoStar, and we've also posted in the Saratoga. And my concern is, advertising is very expensive. And we could spend a couple $1,000 and get 4 days worth of advertising. It's not a lot. I used to, quite honestly, we used to have better luck with, on the county website and our website than we've had recently. I don't know why that is, and I know we are also posting on the Chamber of Commerce website as well, so whether it's the time, I don't know. It's hard to know. I can tell you that I think that whether it's the competitive agencies or not, I don't think it's salary so much, I think it's just the time. I don't know whether people don't want to start a job when it's coming on to summer. Sometimes in the fall, hard to know, and I've been here a long time, and it just doesn't seem to be any rhyme or reason why it is why it is.
Good. Anything else? Okay, what we're going to do next month, as I stated when I kind of first took over this chairmanship, especially for the new supervisors, we're going to go visit some places. Next month, after our committee meeting up here, we'll go and have a tour of Pat's department, if that's okay with everyone. And those that have obviously been there, it's not necessary, but it's nice to see what they're up against. So we'll do that after. It's just easier for the girls to have it up here. I thought it'd be better if we did it down there, but we'll do all our business up here and then take a tour after.
You won't get the full effect unless you come first thing in the morning and after 2:30 or 3 in the afternoon, because that's when we're a real hub of activity, but we'll certainly give you a tour of space. You can do WIC too if you like. That's really close.
Good. Good. Okay, if there's nothing else, motion to adjourn, made by Supervisor Simpson, seconded by Supervisor Sieber. All in favor? Opposed?
Donald was very professional. Donald was very professional.